So, Mike, how are you going about measuring individuality in healthcare today, Mike?
Yeah, great question. A little bit of, our story to ground this question is, really what the work we've been fighting to really get access to in the last several years within healthcare has been, how do you actually think about the role that patients play in their own personal healthcare journeys, and what do you need to go enable that level of individuality? And a big part of that really quickly goes down to something as simple as your health information. And how do I get access to something as simple as what you think is just your medical history? So for us, this is a huge part of the answer, right? And so what we have, a number of folks I'm sure here have every level of health information already on your device, if you know it or not. But what's needed is actually just how do you build the right systems so that you've empowered individuals to have the right health information that they can share privately and securely with the right people when they need it. So we already have all the tools. You're just, we're in a phase now of making sure that we can do it safely and securely, because health information is so sensitive. We need to be very cognizant of that, but the pieces are all there.
Mike, let's talk a little bit about the struggles to share verified COVID vaccine records with entities outside of healthcare, and how it revealed the way personal health information is managed today.
Yeah, we had a front row seat here in Seattle for the last 18 months or so on just the struggles here. And again, on one hand, anyone in the room or virtually who was vaccinated, for example, you likely walked out of either a vaccine site or your doctor's office with a piece of paper, right? And that paper vaccine record was effectively, now we're seeing in society, we're using that for all sorts of things. And so that's non-healthcare asking for personal health information. And so that's actually a really interesting kind of paradigm that we've had the need for vaccines in other areas before, but not to the level that we're doing it today around going to a venue or getting on an airplane or others. The immediate challenge there is just you find out very, very quickly that the access to that proof that you were vaccinated in anything other than that paper CDC card is really, really fragmented at best. Those systems that health systems rely on to go interact with at the state level really aren't meant for patients, and they're not meant for you as an individual. So there's very rarely a patient access portal to say, download my vaccine record and take it with me, and then also prove to somebody that they can then trust that it was a valid piece of information about me. So there's a whole layer, I think, that COVID has also exposed, which is just some of the cracks that we find across the US healthcare system on just the pervasiveness of that access to that data. So it goes back to that same pattern, which is you need better access, you need equitable access, you need to then have the portability of that record somewhere. And if that means taking it outside of healthcare, how do we do that in a way you still trust it as if it came from your doctor in the first place? So it's a big part of the struggle.